Hello everyone, today we're going to be talking about the skeletal system. So, although a skeleton sometimes symbolizes death and creepy, scary things, it is one of the body's most life-living systems. Unlike other living organs, bones are firm and strong, but they have their own blood, lymphatic vessels, and nerves. There are two types of tissues inside bones. Compact bones. This is hard and dense. Tissues make up the outer layer of the most bones and the main shaft of long bones, such as those in the arms and legs. Nerves and blood types vessels live inside the tissue. Spongy bones. The tissue is made up of smaller plates filled with red bone marrow. It is found at the end of long bones, like the head of the femur. And the center of the bones, red bone marrow forms most of the blood cells in the body and helps destroy old blood cells. Another type of marrow is yellow bone marrow. Resides in the central cavities of long bones. It is mostly made up of fat. However, if the body suffers large amounts of blood loss, it can convert yellow marrow to red to make more blood cells. The skull consists of 22 separate bones that make up the cranium, the housing for the brain. 21 of those bones are fused together by surtures. Nearly rigid fibrous joints. The lowermost bone of the skull is the mandible or jawbone.
Spine, or vertebral column, is a series of irregular shaped bones in the back that connects to the skull. At birth, humans have 33 to 34 of these bones. But bones fuse as we age, and the result is 26 separate bones in the spines of adults. The rib cage is made up of 12 pairs of bones that encase vital organs in the chest. The bones curve from the back at the vertebral column to the front of the body. The upper 7 pairs meet the sternum, or chest bone. The remaining 5 pairs are attached to each other by cartilage or do not connect. The muscles of the shoulders and arms include the clavicle or collarbone, scapula or shoulder blade, humerus, radius, ulna, and the bones of the wrist and hand. The hip bones are 3 sets of bones, ilia, ischium, and pubes, that fuse together as we grow older. These form the majority of the pelvis at the base of the spine as well as the socket of the hip joint. The sacrum, 5 fused bones, and at the bottom of the spine, and the coccyx or tailbone make the rest of the bones in the pelvic region. The head of the femur, the largest and longest bone in the body, creates the other half of the hip joint and extends down to form part of the knee. It begins the bones of the leg. The other bones of the leg include the tibia, fibula, and the bones of the ankle and foot. Hey, Yo, we studied for bio? We have a test on the skeletal system, man.
Yeah, man, I fell asleep, bro. I was studying earlier.
Well, I've only studied about the jaw and skull. Are you willing to teach me about the other parts?
Yeah, actually I haven't studied about those two, so maybe you could tell me about that and I'll tell you about the pelvis, the spine, and the rib cage.
Okay, man. Sounds good.
Alright, thanks for waking me up, man.
The skull. The skull consists of the cranium and the mandible, or jawbone. It is the semicircular bone at the bottom of the skull and attached to the cranium at the jaw. The mandible is responsible for the up and down motion of the jaw. The skull also provides housing for the eye and optic nerve. This portion of the skull is called an orbit, but it is more commonly known as the eye socket. 7 different bones make up the eye socket: the frontal bone, lacrimal bone, ethmoid bone, zygomatic bone, maxillary bone, palatine bone, and the sphenoid bone. The mandible, or lower jaw, is the bone that forms the lower part of the skull, and along with the maxilla, the upper jaw, forms the mouth structure. Movement of the lower jaw opens and closes the mouth and also allows for the chewing of food. The lower set of teeth in the mouth is rooted in the lower jaw.
The rib cage. The ribs are partially enclosed and protect the chest cavity, where many vital organs, including the heart and the lungs, are located. The rib cage is collectively made up of long, curved individual bones with joint connections to the spinal vertebrae. At the chest, many rib bones connect to the sternum via costal cartilage. Segments of the hyaline allows for some outward movements, and this helps stabilize the chest during inhalation and exhalation. The human rib cage is made up of 12 paired rib bones. Each are symmetrically paired on the right and on the left side. On all 24 ribs, the first 7 pairs are often labeled as true. These bones are connected to the costal cartilage, with the 5 other false sets are not. 3 of those connect to non-costal cartilage and 2 are deemed to be floating, which means they only connect to the spine. While there are some cases of minor anatomical variations, men and women generally have the same amount of ribs. A differing rib count between the genders is largely a medical myth. The pelvic region is the area between the trunk or main body and the lower extremities or legs. The female pelvis is morphologically different in form from a male's, but most of the differences are not apparent until puberty. The pelvic bones are large and broader as they have evolved to create a large space for childbirth. The most noticeable difference are the width of the pelvic outlet. The circular hole in the middle of the pelvic bones and the width of the pubic arch, or the space under the base of the pelvis. The bones of the pelvis are the hip bones, sacrum, and the coccyx. Each hip bone contains 3 bones, the ilium, the ischium, and the pubes, that fuse together as we grow older. The sacrum's 5 fused vertebral bones joins the pelvis between the crest of the ilium. Below the sacrum is the coccyx, or the tailbone, a section of fused bone that is in the end of the vertebral column. The pelvis forms the base of the spine as well as the socket of the hip joint. Spine. The spinal cord begins at the base of the brain and extends into the pelvis. Many of the nerves of the peripheral nervous system, or PNS, branch out from the spinal cord and travel to various parts of the body. Information from the senses travel through the nerves of the PNS to the spinal cord and then to the brain for processing. And commands from a brain travel down the spinal cord and then to the appropriate parts of the PNS, where the nerves transport the instructions to the appropriate body part where action is needed.
So Paolo, thank you for teaching me about the spine, the pelvis, and rib cage.
Yeah, no worries, man. Thanks for teaching me about the jaw and the skull. But I think we're missing one part. I think we need to learn about the diseases for the skeletal system, or the most important ones.
Well, I think I have a friend who studied that last night. If you want, I can call him and ask if he's willing to help.
Yeah, man.
Alright, call him right now.
Hello.
Hey, Zach.
Oh, Joseph, what's up?
My friend Paul and I are wondering about diseases, about the skeletal system. We were wondering if you could help us.
Yeah, sure. I can help you.
Alright. So tell us all about it.
Chondroplasia, also called chondrodystrophy fetalis, genetic disorder characterized by an abnormality in the conversion of cartilage into bone. As a consequence, bones that depend on the cartilage models for development, particularly long bones such as the femur and humerus, cannot grow. Achondroplasia is the most common cause of dwarfism. In those afflicted with the disorder, the limbs are very short, fingers reach only to the hips, but the trunk is almost normal in size. The head is enlarged because of some overgrowth of the vault bones following premature closure of sutures at the base of the skull. Other manifestations of achondroplasia include a bulging forehead, saddle nose, protruding jaw, deeply incurved lower back with prominent buttocks, and a narrow chest. Women with the disorder may have narrow pelvises and subsequently difficulty in childbirth. Achondroplasia is inherited as an autosomal dominant trait. About 80% of cases of the disorder result from new genetic mutations rather than from the parental transmission of defective genes. Affected individuals are normal intelligence and have.
Thanks for that, Zach.
So what about infants? What are the common diseases when it comes to infants?
The most common disease for infants is CAFE syndrome, also called the infantile cortical hyperptosis, a hereditary disease of infants characterized by swellings of the periosteum, the bone layer where new bone is produced, and the bone cortex of the upper arms, shoulder girdle, and lower jaw. The disease is accompanied by fever and irritability. After a series of periodic exacerbations, it subsides spontaneously.
Gaffey syndrome. So what do you think causes that?
In most cases, KCS2 is an autosomal dominant genetic disorder. Genetic diseases are determined by two genes, one received from the father and one from the mother. Dominant genetic disorders occur when only a single copy of an abnormal gene is necessary for the appearance of the disease. The abnormal gene can be inherited from either parent, or can be the result of a new mutation in the affected individual. The risk of passing the abnormal gene from affected parent to offspring is 50% for each pregnancy, regardless of the gender of the resulting child.
So now that you're done with the most common bone diseases, what are the rare diseases for bones? Zach?
Mandibulofacial dysostosis, also called Treacher-Collins syndrome, or Franciscetti Klein syndrome, a rare genetic disorder inherited as an autosomal dominant trait and characterized by some or all of the following: underdevelopment of the cheek and jaw bones, widely separated eyes, malformation of the lower eyelid and lack of eyelashes, resultant conductive deafness, and other less common abnormalities. Respiratory problems may be present in the newborn. Intelligence is normal. Treatment includes correction of the deafness by use of a hearing aid or by surgical construction of an ear canal, and sometimes plastic surgery to enlarge the jaw.
Thank you for your help. I hope it helps us in our test today.
Yeah, thanks, Zach.
You're welcome. I hope you pass your exam and I hope your professor passes you.
Yeah, we hope so too.
Yeah.
Hi Abby,
Hi, Abby.
how are you?
I'm fine. How about you?
I'm fine too. I love you.
I love you more. I miss you.
Oh, by the way, have you reviewed the bio exam for tomorrow?
I have actually studied about the rib cage only.
That's the only part that I haven't reviewed. So I will explain to you first about vertebra column and skull. So could you please explain to me about ribcage after that?
Yeah, sure.
So here we go. The vertebral column is flexible. It connects the trunk to the body, to the skull, and to the appendages. It has 33 vertebrae, which is divided into 5 regions. The 5 regions are I'll show you the picture.
Okay.
The cervical and thoracic and the lumbar, and you also see coccyx,
Yeah, I can see.
and the sacrum. The lumbar is the one that carries the upper body's weight and providing flexibility in movement to the trunk region. It also protects the spinal cord and nerves. Within their vertebral canal, the cervical protects the head and protects the spinal cord. The thoracic is between the cervical cord and the lumbar, which supports the weight of the upper body and protects the spinal cord. The coccyx anchors many muscles in the pelvic region and acts as one of the bones that bears the body's weight. The sacrum supports the upper weight as it spreads into the legs. So next part will be about the skull. So the skull consists of the cranial bones, facial bones. The cranial bones are the frontal, parental, sphenoid, and temporal occipital. And these bones are the ones that protects your head and your brain. The facial bones are the bones of the anterior lower skull. There are two inferior dorsal concave and two lacrimal and one mandible and two maxillae and two dorsal bones, two parenting and one vomer and two zygomatic bones. So could you please explain to me about rib cage?
Yeah, so it's my turn now to explain the rib cage. So it is a bone cage that encloses vital human organs formed by the sternum and ribs. It is divided into several parts: true ribs, true ribs and false ribs, costal cartilage, sternum and manubrium, ligaments, bones of the head and the neck, shoulder joints, true ribs and false ribs. True ribs are attached to the sternum directly by the costal cartilages. The costal cartilage forms a semi-movable joint between the true ribs and the sternum. The sternum and manubrium protect several vital organs of the chest such as the heart, aorta, vena, cava, and thymus gland that are located just deep in the sternum. Ligaments are short band of the tough, fibrous connective tissue that connects two bones or cartilages or holds together a joint. Bones of the head and neck movement of these bones by the attached muscles of the head provide facial expressions, eating, speak, and head movement. The shoulder joint, these two joints work together that allows the arm to circumduct in a large circle to rotate around its axis or its shoulder. So, this is the rib cage. Can you see?
Yeah, I see rib cage.
So, that's the rib cage.
Thank you, Yabi.
Okay, now so hopefully we can really answer the exam for bio.
Yeah, I will pray for us to pass the exam.
Okay, so let's
Thank you.
Bye.
Love you. Bye.
Love you.
Love you more.
Finally, we're done. We can now hang out together.
Oh, wait. Shit. We forgot to study about upper phalanges.
Yeah, even the lower phalanges. Oh, I think Zach knows about it. Maybe you can ask him.
Oh, sige, let's go.
Okay.
Hi, good evening. Kuya. Is Zach here? Oh yeah, he's there. I think he's studying. Hi, Zach.
Thank you. Hi, Zach. Oh, they're also studying.
Hi. So, how can I help you guys?
We need your help on upper phalanges and
Lower phalanges.
Perfect. I just began studying it. So, upper phalanges. There are 7 bones that makes up the upper phalanges. The scapula, the humerus, the radius, the ulna, carpels. So first the scapula. Scapula is the bone that connects humerus, upper arm bone, and column bone. And the humerus, which is located at the upper right hand. And the radius, the lower, which connects your lower forearm and your wrist. The ulna is the bone that extends from the other side of the elbow, attached to the muscles. The ulna perform in the arms and wrists. And ulna extend from the forearm to the elbow and to the wrist. The carpels allows the easy and free movement of the wrist. 8 carpal bones, the scaphoids, capdate, trapezium, trapezoid, lunate, trapeculate, and fusiform and hinate. So the metacarpals make the phalanges fingers movable. There are 3 sections of metacarpals: the proximal phalanges, intermediate phalanges, and the distal phalanges. These bones makes up the structure called fingers. And up to the lower phalanges is the pelvis. So the pelvis functions for females as a birth canal, and for both male and female provides attachment for the muscles that balances and supports the legs and thighs, and also the hips. So you guys know that?
Yeah. So, we have got it. How about you?
Yeah, good. Thanks,
Sure.
Yeah.
Yeah. Thank you.
And welcome guys. So that concludes our presentation on the upper and lower phalanges.